Hello friends, today's video is about understanding of a remedy. This remedy is particularly used for complaints of liver. Okay, and you must have used this remedy in your family. You would have prescribed to your friends, okay, and to many patients, especially for smooth liver pains. Yes, the remedy is caulophyllum. So there is one symptom in this caulophyllum, and this is liver pains are too weak and irregular, and the liver pains are very spasmodic. Then there is there is this rigid os. So today's video is about understanding this phenomena in caulophyllum. Why is this thing happening in caulophyllum? So the particular seat of action of this caulophyllum is the uterus and the cervix, and second is the joints. So I am not explaining about the joint. So today only about the rigid os. Why is this rigid os in caulophyllum? So let us try to understand this. There is one rubric mentioned in caulophyllum. Delusion pregnant she is. This is very important delusion of caulophyllum. I'll try to explain this delusion in depth. So Dr. John Sholton has very beautifully explained the theme of this caulophyllum, and when I studied the rubric, I was able to correlate, I was able to further understand this remedy, why this remedy is working so nicely. So this caulophyllum personality or the caulophyllum female, from the beginning she has a doubt about her own self. She feels, because of the timidity, she feels that she will not be able to bear the responsibility of child. Okay. So because of that timidity, because of that anxiety, she feels that she is too weak to raise the children. Even she feels that she is too weak to give birth to children. And again, she feels that the children are too weak to survive in this world. Okay. So this feeling, the caulophyllum personality is keeping inside. Okay. Again, this caulophyllum personality wants to take care of children very much, but they again have an anxiety that they are too weak to bear the responsibility. They have a fear that they will not be able to conceive, they will not be able to complete the pregnancy. They are too weak to withstand that labor pains, and even after the child is delivered, they will not be able to generate enough milk. So somewhere they point their finger towards the own self. I am weak. So this is the feeling, this is the self devaluating feeling which goes into the ligaments of the uterus. Because of this self devaluation, that I am weak, I will not be able to bear, I will not be able to perform, the uterine ligaments become weak, and that is why the uterus also becomes weak. So there is tendency for uterine prolapse. Then again, When this caulophyllum personality or caulophyllum female thinks that I will not be able to bear the child, what happens to the uterus? The uterine muscles become very weak, and when this caulophyllum person feels that even though, because when he feels that I will not be able to conceive, or I am too weak to conceive, I will not be able to conceive. So, first there is infertility, and even by chance, if there is pregnancy and caulophyllum person comes to know that you are now pregnant, still that feeling that I will not be able to carry forward this pregnancy prevails. And because of that, the uterine muscles becomes so weak. And when there is time for the labor, this caulophyllum personality feels that this child is very weak and he will not be able to survive outside. There is very strong feeling in this caulophyllum that the child will be very weak because I am weak. The child will also be weak, and so he will not be able to survive. So what the mother has to do? So mother has to hold the child in the uterus itself. That is why the os becomes very rigid. Caulophyllum does not want the child to enter into the world because there is a feeling that this child is very weak, he will not be able to survive. So caulophyllum will be keeping the child in the uterus itself. That is why the labor pains will be very much irregular. The uterine muscles will not contract properly. The os will be very much rigid. Okay. Then, even though the child is delivered, still caulophyllum will take care of this child in lot many ways. This child will be protected by caulophyllum because the mother thinks that this child is very weak, he will not be able to survive in this world. So always there will be constant protection for this child. Okay. So what is this child being kept always in the protection of the mother? One day the child has to move out, he has to move to college, he has to move to his job at some other place. That is the very anxious situation for caulophyllum mother. She does not want that child to go out. Okay, because she knows that the child will not be able to survive. So she tries to protect him. And you know, friends, what is this situation? This is as if she is still keeping this child in her womb. This situation is exactly like she is keeping this child still in her uterus. So this is delusion pregnant she is. So this is the understanding of caulophyllum with respect to this rubric. So this caulophyllum mother will never allow this child to separate from mother because it is very painful situation for mother. She feels very alone, and again she has an insecurity that the child will not be able to survive in this situation. So this is keeping the child in literal sense, keeping the child into herself, keeping the child in the uterus, keeping the child under the protection of the mother. This is delusion pregnant she is. And that is why this symptom is there in the caulophyllum, rigid horse. So thank you friends for viewing the videos, and please like and share. I hope I was able to give you something about caulophyllum. Please share your experiences also. Thank you.